Dr. Dattani, what are teeth implants and what is the process involved?
A dental implant is essentially a titanium screw about 1 centimetre long which replaces the root of a tooth. That actually fuses to the bone. It becomes part of you, and once it's integrated, that means fused, it's physically impossible to remove. The hip surgeons borrowed our technology, and that's, if you can imagine, if it can take the forces of someone walking, it can take the forces of someone biting. On top of that, we screw and glue a crown on top, and that's the part you will see. So the whole process involves the titanium screw, known as the implant, and the crown and the abutment that goes on top. What was the second question?
What are the processes that are involved? What would somebody go through?
It's a surgical procedure, similar to having a tooth removed. So the first process is we actually may need to remove teeth, may need to clean the teeth, we may need to do your fillings. Your mouth has to be completely healthy before we can place an implant. Once it is, we'll then do another surgical procedure like taking out teeth, but we're actually screwing the screw. We then wait 3 to 6 months to allow this healing period, or integration, or gluing to the bone, which will take anything, as I said, up to 3 to 6 months. Once that's done, we will then take impressions of the implant, send it to our technicians, which are all based in London, who will then replicate your teeth in forming a new tooth, which will then be screwed on top of the implant. That process, from the integration finish to the actual fit of the implant crown, takes about 6 weeks.